When somebody first begins to explore hormone therapy, I think a lot of the times their expectations are high. They expect to feel better overnight or within a week or two. And unfortunately, that's not how hormones work all the time. Not necessarily saying that that can't happen, but hormones are definitely a long-term game, and it's a domino effect. Once we get a good, adequate amount of hormones in your system, everything, your cells are going to work better, your tissues are going to work better, your organs are going to work better, and that takes time, right? Just like weight loss or anything else that is worth it, it takes time. When patients tell me that they went to their PCP, they had their labs checked, but they don't feel normal, for one, I tell them I believe them and I validate what they're feeling. And I tell them that, your labs are, especially with a PCP or general wellness labs, those are going to tell us if you have a clinical disease process going on versus not. But it doesn't necessarily mean that you are going to feel good. Okay, so first, when we're looking at standard lab ranges, we have to ask what labs were gotten. And there's a difference between a full comprehensive panel versus basic labs. So when somebody tells me they're within normal range, I tell them, well, what is normal? I don't even like the word normal because labs were basic or lab reference ranges basically are determined by like an average of people. Usually laboratories study 120 to 700 people, and they have to meet certain qualifications of health. But even what is health, right? What is healthy when they're getting these reference lab ranges? And maybe it's that they don't smoke, they don't take certain medications, and that's about it. So it's a general population where their labs range. That's what normal is. But if you're on the low end of normal, or your labs didn't even get anything that would, really geared towards your symptoms and give us the diagnosis for your symptoms, then that doesn't really tell us the full story. So another thing I like to talk about when it comes to somebody being within normal range is these lab reference ranges are based off of our normal average American population, right? Ages 18 through 50 maybe. But it's not going to be the Supermans of America and the Superwomens of America. Like if we were to get the labs on those people and those were normal, that's what optimal would look like. When I speak of optimal, usually it's more functional lab ranges, meaning the top quarter of something or the bottom quarter of something, depending on what you're testing. But that's where most people feel better. And that's the difference between normal and optimal. So reference ranges are established by studies on average people, normal people. There's certain inclusion and exclusion criteria, but they're based on age, they're based on sex, and whether they're healthy or whether they have a clinical disease process going on or not. So it's a very small group of people when they determine these reference ranges, and it's supposed to be like basically 95% of people are going to fall within these ranges. So it really doesn't tell us, the full story. The symptoms that I see that are commonly overlooked when somebody's general labs are normal are things like fatigue, anxiety or depression, insomnia, joint pains, low libido. That's kind of just the basic, the surface level. But, a general lab panel is not going to rule out the cause of those symptoms, which a lot of people are suffering with. So for basic lab panels, we usually your PCP will never include hormones, sex hormones or thyroid hormones. And this is mostly because of insurance guidelines, and they're just not going to pay for them unless you meet certain criteria. But sex hormones like testosterone, estrogen, progesterone, DHEA, cortisol, iron, ferritin, free T3, free T4, all your main thyroid markers, none of those are going to be included in a basic lab panel. So a single lab draw does have some value, especially when it's compared to symptoms. However, trends help us see more, and I prefer trends. I want to see, the more data you have, the better your research is going to be, the better your outcome is going to be. So I like to see trends. And also, when we're looking at labs, it's one pinpoint in time, right? And these labs fluctuate literally on a daily basis for some people, whether it be your thyroid or your iron, they can fluctuate daily. So just getting one pinpoint in time isn't going to tell us the full story as much as a trend of labs would. So when a patient is told that their labs look normal, what they should then ask is what labs were drawn? What did they show? A lot of PCPs just say, oh, everything looked normal. You're good. And there's no follow up to that. So a patient should advocate for themselves and ask, well, what did this rule out? What did these labs rule out? Did it include hormones? Did it include thyroid markers or iron or anything else that could explain my symptoms? And also, they should ask, does this explain my symptoms? And is there anything else that we need to explore or that we could add that could help me determine a cause for my symptoms? So, someone should consider getting a more comprehensive evaluation when they've been told that their labs are normal and they still have symptoms, honestly. So, when you come to see me at Redline, I start with a comprehensive panel. I avoid insurance, so that allows me to get more deeper labs. I don't just get the basic ones, I also check your iron, your ferritin, your thyroid stimulating hormone, your thyroid hormones. I rule out multiple things. And is that always necessary? No. A lot of the things that we get could be normal. However, I don't want to waste time. I want to see and rule out multiple diagnoses and get a full picture of why your symptoms are, sorry, I want to get a full picture at what your symptoms could be caused by. So, when somebody's been written off by their PCP and they're starting to wonder if a lot of these symptoms are in their head, the first thing I tell them is that I believe them. Their symptoms are real. Our body is going to tell us when there's something wrong, just like a car is going to turn on the check engine light when there is something wrong, not after it breaks down. So, it is okay to dig deeper and to try to find a real cause for this. And it's not always hormones, honestly. We might have to look a little bit deeper. We might have to do, more honest conversations, but your symptoms are real and you deserve a full workup to determine if there's anything you can treat it with. So I'm always very honest with my patients about what I see in their lab work. And some days I have patients that I don't think it's their hormones, and it depends on their symptoms that they're coming into me with. But this might lead to deeper conversations about their other life stressors, about their sleep, about their diet, what they're ingesting and putting into their bodies, whether or not they exercise, whether or not they get sun on their skin. So, maybe even what kind of job they have, what does their marriage look like? Because it's not always hormones. You might have plenty of hormones and there might not be a deficiency that we see, but it could be other things. And then I also check thyroid hormones. I also check iron and ferritin. I had a lady once who swore it was her hormones, and I check an iron and ferritin and she's completely iron deficient. So we start treatment for this and she feels so much better. But if she would have gone to her PCP with that complaint, that wouldn't even been checked. So that's important to know too. It's not always your hormones, but I will help you figure out whatever it is and what we can do to make it better. So, when somebody first begins to explore hormone therapy, I think a lot of the times their expectations are high. They expect to feel better overnight or within a week or two. And unfortunately, that's not how hormones work all the time. Not necessarily saying that that can't happen, but hormones are definitely a long-term game, and it's a domino effect. Once we get a good adequate amount of hormones in your system, everything, your cells are going to work better, your tissues are going to work better, your organs are going to work better. And that takes time, right? Just like weight loss or anything else that is worth it, it takes time. So sometimes I feel like people see HRT as a quick fix, specifically because it's, a medication. And a lot of the times in traditional medicine, we expect, like, oh, I started this medicine, so I'm going to feel better tomorrow. And also, I think it's because we live in an instant gratification society. Like, you can literally have a Snickers and a six pack of beer delivered to your backyard by a drone in like 15 minutes. So that's just how our society is. We have everything at our fingertips. So of course, when you reach out for something, when you invest in something, you want it to be fixed quickly. And I totally understand that. So, it's a conversation we have to have, and we talk about patience through the process. It's a journey, not a sprint. Realistically, hormone therapy can help with so much. And honestly, I like to put it in tiers, right? So the top tier, the surface level, it can help with the outside symptoms like night sweats, hot flashes, poor sleep, joint pains, low libido. But then there's this second and third tier, which is more a quality of life help. You wake up in the morning and things don't feel as burdensome as they used to. You want to play with your kids more. You have more motivation and drive to either, promote in your business or open your own business. And then the third tier, I feel like, is more of like emotional well-being. Your Aside from just your physical well-being, it's your emotional and your spiritual well-being. Hormone therapy can help with all of that, and eventually it can produce a form of self-actualization and the ability to want to find your purpose in life and overall live a higher quality of life. So the five basics, I like to call it: sleep, stress, sun, exercise, and diet. These all matter in your hormone replacement therapy journey. If you don't do these things and get these things right, then you're not going to get the optimal benefits of hormone replacement therapy, because you have to have that foundation of those things in order for the hormones to be able to work appropriately. I had a patient once who was on testosterone replacement therapy. His levels looked optimal. Everything looks great, but he's not exercising. He's drinking alcohol a couple of times a week. He's eating fast food all the time and gaining weight and not moving his body and sleeping terribly. And he's not feeling well. And at the end of the day, I'm like, this isn't your testosterone anymore. This is the lifestyle factors. And if you don't get those right, then there's really no point of being on testosterone or having an optimal testosterone if you don't get those other things right. So, if someone wants the benefits of treatment and they're not willing to change their habits, then they have to, they might get some benefits from it, but they have to change their goals. They have to realize and be honest with themselves. I'm not going to, look like Superman. I'm not going to gain a bunch of muscle mass and lose a bunch of weight and totally change my life if I don't put these other, or if I don't do these other things right too, because your input the things that you put in your life is going to determine and control your output. So, when a person is not changing their lifestyle and they're trying to reach certain goals, then I have to have the honest conversation with them. I have to use a little bit of tough love, and I have to tell them that, like, if you don't change these certain things, then you're not going to be able to reach those goals. And it's hard, but at the end of the day, I care about my patients and I want them to get the most out of this treatment. So I'm going to be totally honest with them. Also, there's some places that you might go to, more of like those cookie cutter clinics, who are, trying to just make money and they don't really care as much about the person sitting in front of them. And they might not tell you, like, well, you've got to stop doing this, you've got to do this, you got to change that. They'll just keep adding more peptides or more medications to your regimen. And even with peptides, those can sometimes still be a band aid. You're still not going to get the most benefits. In fact, I don't even usually start growth hormone peptides in my patients unless they are exercising 3 to 4 times a week, because I'm not just looking to make money over here. And I want you to get the most benefit out of your protocol. So it's important to avoid giving patients the same protocol because we are not robots. We are human beings. We all process hormones differently. We all metabolize hormones differently. Any medication we process and metabolize differently. We all come from different medical histories, different backgrounds, different cultures. And each individual body is going to respond differently. So you have to take that approach in medicine. And that's exactly what I do. No one's protocol is going to look the same. It might look similar, but it's not going to look the same. So when we're dialing in a protocol, I expect to see improvements in my patients within 3 months. Sometimes it's mild improvements, and then, for the deeper symptom relief, sometimes that can take 6 to 9 months or even 12 months before we start seeing things like muscle mass gain and weight loss. But if you're having severe symptoms, say of hot flashes or night sweats, then I expect to see improvements within 3 to 4 weeks. But this is different for everybody too. Some people might take a lot longer to start experiencing benefits than other people. So once again, goes back to individualized approach. And if somebody is not feeling better within 3 months, we will change up the protocol. We will increase dose. And I don't even necessarily need labs to see like if that's needed or not, because I treat based off of symptoms, but I don't want you to, get hormones and then not see you again for 6 months to a year. That's not how it works. Like, we're going to follow up. We're going to keep dialing in your protocol until we get what's right for you. So we're living in a world where you can literally find a different supplement or a different hormone protocol at your fingertips on social media with influencers. And this can actually be, sometimes dangerous for a lot of people because we're all different. We all have different medical histories. We all metabolize hormones differently and even, supplements. So I always tell my patients, you don't know what their labs looked like prior to whatever protocol they're on. You don't know what their medical history was. You don't know what they were suffering from. And a lot of the times with influencers, we have to remember that like they're hired by these companies to promote this stuff. So they might not even be taking it. Or even just a friend, like what works for a friend might not work for you. That's why it's so important to avoid wasting your money on a bunch of supplements and trying to do things yourself and figure out things yourself. Just go to somebody who is going to take care of you, who's going to do a comprehensive panel, and is going to give you a treatment plan individualized to you. What separates patients that get strong results versus those who struggle to get results is really those who are patient with the process, who are consistent, who make the changes that they know they need to make, and ask questions and communicate about what they're feeling and what needs to be changed. The patients that get the strongest results are those who take personal responsibility and meet the medicine halfway. These things that I'm giving you, those are tools. And if you don't do your part, then you're not going to get the outcome that you want. So the people that get the most out of hormone replacement therapy are those who have taken personal responsibility for the things that they can control. They've come in and they said, I've changed this. I've changed my diet. I started working out. I started going to bed earlier, and they're likely going to get more results versus the person who continues to make excuses for being unable to do those things, and that's a conversation we have to have. I have to tell my patients that don't want to make those changes, you're not going to get the results that you want to get out of this. So I approach the tough love conversations with honesty At the end of the day, I want my patients to get the most out of this. I want them to feel good and I want them to live their optimal lives. I do not want them to just waste a bunch of money or time doing something that is not going to change their lives. So I never shame anybody. That's just not who I am. And I'm honest with them and I tell them what they need to change. And I help them to make small, measurable, realistic goals. So if you're not working out at all, okay, we're going to start 2 days a week with this specific workout that you can commit to. I don't expect you to come in and just change everything in your life. We're going to make the SMART goals, measurable, realistic goals that you can start incorporating in your life. And then we're going to build on those things. So, in the first 90 days of treatment, this is going to look a little bit different for men versus women. And it's also going to really depend on the symptoms that they came in with. But the first 90 days, I would expect them to have more energy, to things feel less dreadful. Maybe it helps with their hot flashes or night sweats if they were experiencing those. I expect them to have a boost. So, what I would tell a patient that they should be able to expect within the first 90 days would be, um, improved cognitive function, less brain fog, maybe some improved energy. Things don't feel as burdensome as they used to. It's simple things, right? And then over time, there's a domino effect that happens. Everything just keeps getting better and better. Eventually, your anxiety gets better, your depression gets better, your muscle mass increases, you are able to lose weight. But those things can take a little bit longer. So I would define success once starting any kind of treatment as feeling more like yourself, waking up with more energy, having the energy to play with your kids and not wanting to, be a recluse and couch rot all day. I would define success as, better relationship with your spouse and just the ability to want to live a higher quality of life. So before someone schedules a consultation with me, I would want them to understand that I care and I'm going to do whatever it takes, even if that's out of my realm or out of my scope. I'm going to help you. I'm going to get the labs that you need to get, or I'm going to refer you to another specialist that needs you. I'm also not going to start something in you if you don't need it or if I don't think you need it and maybe you need something else. I'm going to do a full comprehensive panel with you. I'm going to ask you a lot of questions, and some of them might be uncomfortable questions, but I want to get to know you and I want to see exactly what's going on.